Thank you. Good morning, everyone. I'd like to call this meeting of the Cook County Public Health and Human Services Board to order on this Tuesday, February 20th at 8:32 a.m. First item is the approval of the consent agenda, which includes our meeting agenda, minutes, financial reports, abstracts and bills, approval of United Amendment to the Electronic Document Management System, Regional Joint Powers Agreement, appointment of Public Health Human Services Advisory Council member, approve renewal of contract addendums with Sawtooth Mountain Clinic, and then 4D Child Support Cooperative Agreement for 2024 through 2025, and that is the extent of the consent. Is there an item someone would like to pull and discuss further, or any changes or adjustments to the agenda?
Chair Mills, there are none that I see, so I would have a motion to approve the consent agenda.
Thank you, Commissioner Sullivan. We have a motion. Is there support?
I'll support. Oh, go ahead. I support.
Thank you, Commissioner Wright. We have a motion and support. Any further discussion? Hearing or saying none, all in favor?
Aye.
Aye. Opposed? Motion passes unanimously. Thank you. And that moves straight on down to our staff report. Before that, we have our Community Health Assessment and Health Improvement Plan with Grace Grenager here.
Hello.
Good morning. Welcome back.
Yeah, I know it's been a while. I was just thinking it's not a COVID update today. We still have COVID, but I don't have to give updates because we're not quite at that level. So I do have a PowerPoint this morning, which will be coming with us shortly. So I think several of you have been involved in the community health assessments, community health improvement plan process to date. We have had a few meetings last summer, and then prior to that, we had a review of the previous cycle's plan. So this is sort of a review of where we're at, and we're picking things back up and moving into the health improvement planning phase. So I wanted to give you all an update on what that means and where we're going to go from here. So to start off, the community health assessment and the community health improvement plan are both requirements of local health departments across the state. So it's in state statute that every 5 years we complete a plan and we complete an improvement plan, or an assessment and an improvement plan. And so it's really a cycle. It's something that we're constantly looking at, refining, implementing, and then starting back again with looking at the data. So that image on the screen is really looking at it as a cycle rather as something that we pick up every 5 years, finish the report, set it down, and then don't look at for 5 years. No, this is supposed to be something that we're engaging with consistently throughout that 5-year cycle. So the assessment portion is looking at all of the data that's out there. It can be census data. We have regional public health data through the Bridge to Health survey. We have youth data through the Minnesota Student Survey. And then we also sometimes notice that there are gaps in what we have and go out and find data locally through surveys, through interviews, through focus groups. And so the data gathering is a combination of looking at all that's out there and trying to pull in what we don't see in those bigger data sets. Prioritization, that's what happened last year when we got together at those community meetings, reviewed the data together, and decided what was important to us as a community. And then we come up with this plan. So that's where we're at right now. We're moving from, we have our priorities, we have our vision. Now what are we going to do with that? So that's where I want to focus a lot of our attention this morning. And really, this is not a process that is just public health and public health staff. It's designed to be a community-driven process. So we're supposed to be bringing in partners from the clinic, the hospital, community members at large, nonprofit partners. And so that's what we've aimed to do so far. So that report, that community health assessment report, is live on our website, and it's available for all of you to use, to look at. If you're ever wondering, something about community health, it's great because you don't have to go digging through all those data sets yourself. You can just look at the report and everything is all combined and right there for you to look at. We've had partners report that they use it to write grant applications because you don't have to go looking for all of the information on demographic data or household income. Everything is kind of in one place. And so that's really what we want. We want this to be a useful tool that people actually use throughout this 5-year cycle. And we know that it is being used that way. So this is what we came up with last summer when we had the community meetings in terms of what our vision is. What are we aiming for in a broad level? We are aiming for community health in Cook County that includes everyone having equitable access to resources and supports that they need to thrive across the lifespan, a welcoming community that understands our interconnectedness, a shared understanding of health and what creates health, a sense that individuals' contributions to community well-being make a difference, and using data to deepen our understanding of health issues and to evaluate current programming that's available. Then these are the health areas that we came up with as our priorities for this 5-year cycle. Access to affordable housing, access to mental health resources and support for well-being, access to affordable quality childcare, access to transportation options, access to affordable healthy foods, and access to physical health services. So it's quite a few priority areas. We had sort of a tie for spots 4, 5, and 6 there, but we decided that they're all important, and we do know that there are members of the community working in all of these areas. So in order to document that and keep that momentum going, rather than paring it down to just 2 or 3, we kept all 6 as priority areas. And one thing I'll bring up when we look at this list is a lot of these are what we call in public health the social determinants of health. So those are the parts of the environment, the places where we're born, we grow, we work, we go to school, and what those environments and what those conditions do in terms of affecting your health. So there's been quite a bit of research that shows that yes, those interactions with your medical provider are important. The health behaviors you choose to do every day are very important, but really what makes a great deal of difference are these contexts that people live every day. So all of these are what we call social determinants of health. And that wasn't something we just put in there as the public health team. That was what the community came up with, is really what we should be focusing our efforts on to make sure that we have a community that is experiencing health to the greatest extent possible. So I like to think of the community health assessment as like a map. We kind of take the lay of the land, we see where people are at, we mark off, sites of interest, but then the community health improvement plan is how we get from point A to point B. It's using that map to do something that we've decided collectively we want to do. How do we move towards those priority areas? And when I say we, I don't just mean PHHS, I mean the whole community. We want to be really documenting other efforts that are happening that further community health, even if it's not something that our staff internally in the department is a part of. For example, when the clinic started to offer telehealth services, that was huge. That was a huge win for community health, and it was a big win for our last community health improvement plan. It wasn't something that PHHS staff was necessarily an intimate part of, but we all benefited from that change. So we want to be sure that we're documenting all of the things that are happening to bring us closer to these priority health areas. And some of these things on these maps or this plan are things that we are part of. So the next slide kind of shows, and I know this is kind of like small print, so I'll just say this is a small excerpt from our last plan, and it shows sort of the format that we use for the planning process. So we come up with, this was our priority area from the last cycle. It was people who've experienced substance abuse have support to move toward recovery. That was our priority area. And then we broke it down into strategies, activities, partners, or in other words, who's working towards this goal, and what's the timeline here. So when we created our last plan, youth vaping had really come on the scene as a huge issue. So quite a bit of what we had in the plan was addressing youth vaping. We also, at that point, realized, we didn't have any sort of prevention work going on within our team. And so we had proposed adding in what now is Andrea Orrist's position to do prevention work. So we found grant funding in collaboration with the University of Minnesota through the Rural Communities Opioid Response grants, and we were able to bring more staffing on to help us work towards this goal, because we realized, there's nobody who's really doing this prevention work in a way that we'd like to see. That's something that we could fill in our department. We're really well positioned to do that. And so that was built into the Community Health Improvement Plan last time around. And what's fun for me is to look back and say, oh, hey, we set out all these priority areas. We came up with this plan. And look, a lot of this we accomplished. So if we develop this plan and then revisit it periodically, we can actually see written down what our accomplishments have been as a community, which is really rewarding. We'd intended to do quite a bit more with this the last cycle, but of course, 2017 to 2022 was largely taken up by pandemic response. So I'm hopeful that this cycle that we're in right now, we can really come back and revisit this with our partners and with our advisory councils on a more regular basis to see what kind of progress we're making and where we still have gaps. So back to developing the plan. Here are our priority areas, and we know that there are groups in the community that are already meeting to address these issues. So for example, access to affordable housing. We have the HRA. The HRA has a board that meets regularly. We also have the Healthy Housing group that is part of the Healthy Housing grant. That's a group of people who are really passionate about housing issues. Can we connect with individuals and groups like that that already exist and just run through an exercise with them of what activities are on the horizon for the near future, and then document that so we have this kind of compilation of what's happening throughout the community with all these areas. And going down the list, I'm aware of a number of these areas where there are groups already meeting. So for number 2, for example, the Mental Health Advisory Council, the Prevention Coalition that Andrea is forming, those would be groups that we would approach and say, hey, can you help us develop this roadmap of how we're going to move towards this priority health area? And there could be people who aren't part of those groups that want to be part of this planning process. So how are we going to involve them? I think part of it is making sure that, for example, the Public Health and Human Services Advisory Council gets an update once a year that's publicized, that we can say, hey, if you're not a part of this conversation and you want to be, you can see what we've done so far. Get in touch with us in public health. We'd love to have your voice be a part of this project. We're trying to find ways to really bring people along for the ride here. So that is the plan so far. The community health assessment is available online. It's also available in paper. If people want a paper copy, they can get in touch with us, and we're happy to mail those out. We also have some at our front desk that people can come and just take. They can ask for them at the front desk, and we can give a copy out. We're also going to be creating like a 2-sided handout of the plan. The plan is the health assessment is pretty long. So if you wanted to, say, meet with someone who's never been in Cook County and share the health assessment, rather than giving them this huge report, the idea is that there's a two-sided handout you could use to just say, hey, this is what's going on in Cook County. These are our priorities for community health. And then that's much easier to digest than going through a giant report with someone who maybe doesn't have that kind of time. Like I said, meetings with partners, that's really the next step in the process. That and the handout are kind of the next things on my to-do list when it comes to the Community Health Improvement Plan. And then the data that we use in the health assessment is also changing. So we want to revisit this every year and say, what are the data points that we did not include because they just weren't around or they've been updated. So the census goes through updates periodically. The student survey does as well. The Bridge to Health also gets updated. And then there's some initiatives that we have within our department that give us more information. For example, right now, the Age-Friendly Communities Project, we've had about 300 people answer that survey so far. So we're going to have a lot of information on Cook County becoming a more age-friendly community that we want to include in this as well. So whenever there's new data, once a year, we're going to kind of update it, give it a refresh based on the latest data that we have. And then, remind people, these are out there for use. They're not reports that we want to just do because it's in state statute and then set on the shelf. We want people to use these to apply for grants. It's really gratifying to hear from people, hey, we wrote a grant and we were successful and we took data out of that health assessment. That makes me think, oh, this was a really worthwhile exercise. That saved someone time and it brought more resources into the community as well. So that's kind of where we're at. Happy to get feedback from all of you, questions, happy to take questions as well. It's an exciting project. It was sort of picked up and put down for a little bit as I was on leave, but now that I'm back, I'm happy to be working on it again. So thanks for listening to me talk about the health assessment this morning.
Thank you, Grace. And the timing you had coordinating with your leave, I thought, worked out very, very well. Well done there. Any questions, comments?
Question,
Yes,
Commissioner?
please. Commissioner White.
When will this two-sided handout be available?
As soon as I make it, so hopefully within the next couple of weeks here.
And where and how will it be distributed or available to the public?
Well, I'll have Allison include it in the next PHHS board meeting, but I can also send it to the commissioners as just a informational handout because it'll be ready before the next board meeting. So if you want access to it before then, I can.
Would
I can
this
send
be
it to all of
something
you.
that real, of course, there's no houses to buy anyway, but someplace, it's an advertisement for Cook County, for this is who Cook County is. And for people traveling through, I don't know if it's beneficial, when there was more of a housing market, people trying to decide to come here or not. I guess it's really changed now from a few years back. Everyone wants to live here, but there's no place to live.
Right.
So,
I mean, it does say access to affordable housing is a priority. So I think maybe it shows that there's some
Effort.
Awareness of
Yes.
the problem.
Yeah, that's a great suggestion. Though.
Yeah.
We could give it to Visit Cook County. We could give it to the EDA, both for business recruitment as well as visitors, like you're saying. It's a good idea. Other questions, comments? Please, Frank.
First, Grace, thanks. That's excellent work. That's, as you say, completely ongoing, and will be with us for many years. But can you highlight changes in the priority areas from the last plan to this plan?
Sure. Let me see. I can go back to looking at them. So some of them haven't changed. So housing was on there before, it's still there. Affordable quality childcare before was more generally just an early childhood focus, and this priority was pretty honed in on childcare specifically. Mental health resources and support for well-being was in the last cycle. One was focused on supporting people in recovery, and one was mental health resources. So it's sort of combined into one priority area for this new cycle. Affordable healthy foods was not on there before in the last cycle. And when you dig into the assessment, there is data showing that there was a pretty significant rise in visits to the food shelf and some measures that indicate like household economic security. So in that sense, it's not surprising to me that it made it onto the assessment for this cycle. Transportation also was not on there in the last cycle, so that one's newer. I mean, I think struggles with transportation aren't new, but it made it onto the priority area list, and it wasn't there before.
Is this particularly healthcare related transportation, or just in general transportation?
It's with a lens of healthcare, but some of the data on transportation shows that like ability to get transportation to and from a grocery store, or to make social connections, to visit people, that also has an impact on health. So I think you could make an argument that it's a little bit broader than that, but I think the conversations that we had were focused largely on travel to and from Duluth or the Twin Cities, or even to and from the clinic for medical care. So it is focused on medical transportation, but I think you could make an argument that it's a bit broader than that as well. And then physical health services, in the last cycle that was access to specialty care, but I think that the conversations that happened last summer were more, strengthening the services that we have. So even if it's not specialty care, making sure we continue to have robust access to primary care, strong EMS system, access to services, hospital-based services. So it's less focused on that specialist piece and more broadly access to medical services in the community.
Okay. Thank you, and I would just like to give you a very strong second. As you say, these are all really, outside the realm of what most people would think of as public health, inspecting restaurants, giving vaccinations. No, we've gone beyond that, and now this is looking more toward the root cause. So kudos to you for leading that effort.
Yeah, that's one of my favorite parts about it, is getting down to those determinants of health and how closely, our priorities match that, and just comparing to other community health assessments from the region. I like ours a lot. I felt like it did a better job at getting at those roots, and I'm really excited to see we have so many partners already in each one of those. You can kind of go down that list and be like, ooh, we should leverage that partner more. Ooh, leverage that partner, just going down. So it's really, really exciting. Other questions or comments? Please, Allison.
I just want to thank Grace for your report, a really excellent overview of the health assessment and health improvement plan. As I think back on my time with the county, we were beginning specifically in this position, we were beginning the last health cycle when I was newly promoted into the director position. So I kind of see my career trajectory mapped out across our 2 health assessment cycles in many ways. And I'm just so proud of how our department and how our community has invested in this as a priority, how we've really dedicated resources to this process. And I think it really demonstrates the impact that we can have on community health when we have the resources behind these processes to really have a collaborative process around how are we strategically aligning our resources with what the community defines as priority health issues. Prior to 2017, our staffing model was we had 2 public health nurses who were primarily doing skilled nursing services. They didn't have the capacity to do this kind of depth of community engagement. And just a few other examples of how this is connected to our work and in the community more broadly is our grant making for the public health funds. The strategic priorities defined in our health assessment define how we're allocating those grants out to nonprofits in the community to increase their impact. We also recently presented to the North Shore Healthcare Foundation Board as they're using these as shared priorities for their grant making as well. So again, just really grateful to have Grace in this role and leading this process, and that it's become a true community effort over the last 2 5-year cycles.
Yeah, and that upstream focus with all of our community partners too, it's just really, really exciting.
Yeah.
All right. Oh, I'm sorry, Administrator Yorkie. Yes, please.
Thank you. Thank you, Mr. Chair, and thanks for the great report, Grace. First of all, I agree with everything that's been said. These priorities reflect needs in our community, and I think it's really well thought out. Thinking about sharing information with the public, it's good to share the priorities. It's also, I think, even more impactful to share the results of the work. And I know that, like you said, this is not all within the purview of public health and human services. But, as the plan is implemented, being able to measure outcomes and share those with the community, I think is going to be really important too. And I'm sure you've put a lot of thought into that already as well.
It is very gratifying to share those results out and to see that we've made progress, because a lot of these issues have been around and they'll continue to be around, and they're big. So whenever there's progress made, I think it's really important to share that out and show that we're being responsive to what the needs are in the community.
All right, well, thank you very much. Look forward to updates down the road, and hope you have a good rest of your day, and again, welcome back.
Thanks.
No other questions, it looked like, so we'll move on to our staff report, or I'm sorry, our director report with staff updates. Allison, take it away.
Included an updated organizational chart in your meeting materials. We are currently at 5 vacant positions across the department, with several of those being in work teams, which really impacts the team overall when we have multiple vacancies in a work team, and I'll say more about that in a little bit. In terms of changes since our January Public Health and Human Services Board meeting, really excited about the promotion of Isabella Sheehan from office support to eligibility specialist. Isabella's been with us for a number of years, having worked at the community center previously, and will be bringing all of those excellent customer service and both technical systems skills to her role as an eligibility specialist. She is currently in prerequisite training while continuing to provide some coverage for our front office team, as again, we do have multiple vacancies within that work group right now. We did bring on Rocio Rivas last week as a temporary office support specialist and case aide to help support that really acute need in that work team for continuity of coverage and supporting residents as well as the department as a whole. We have, again, 3 vacancies on that work team right now. Isabella's anticipated. She's in transition. Then Sarah Schoonover resigned back in October. We're still working to backfill that position. And then Ariel Charlier was also promoted from a case aide to an eligibility specialist. So grateful for the ability within our current handbook procedures to be able to bring someone in the short term to minimize the impact to the team and support to the community. We are reviewing right now job descriptions throughout the department. A number of job descriptions and large job families in public health and human services are up for review in that cycle of ongoing reviews with David Drown and Associates, the consulting firm that was hired to review and update all of our job descriptions. We're making some updates to the case aide job descriptions to reflect recent programmatic changes, including transition of the healthcare access program to that regional provider MTM. We are looking at reallocating duties within that work team to ensure coverage of the basic front office operations, as well as the high volume of economic assistance caseload support. We are continuing to recruit for 2 positions on our behavioral health team, those being the adult mental health social work position that has now been vacant for a year, and the coordinated crisis response position that has been vacant since last May. A recent update on the crisis response position: last week you all approved a modification to that job description to align the classification with our bachelor's social work position, so hopeful that that might have an impact on our ability to recruit for that vacancy. All said, the team is really busy across the board. I was approving time cards on Friday and counted that 14 of our current 29 staff had excess hours in the last pay period. So very concerned about the ongoing impact of multiple vacancies on our team, especially multiple positions within a work team for a prolonged period of time. Any questions on staff updates before I move on?
Looks like not. Thank you.
The financial report that you approved on the consent agenda is about where we would expect to be at this point in the year. Public health fund payments were issued out to grantees in January, so fully expended in that line item for the year. We are still bringing in revenue for the services we provide through billing, through quarterly reporting, through quarter 3 of 2024. So expect to see additional revenue for year end 2022 and the early part of this year going forward. Grace in her report mentioned our newly formed Substance Misuse Prevention Coalition. March 19th is the first scheduled meeting for that group. Already have some interest with community partners and others who want to be involved in developing that strategic prevention framework and advising our department and the work of the Rural Communities Opioid Response Partnership. If anyone's interested in getting involved, reach out to Andrea Orest, who is our prevention coordinator. Again, that meeting is March 19th on Zoom. Andrea was recently interviewed by WTIP and featured in a multimedia overview on our harm reduction and prevention efforts. Invite you to take a look at that. There's a video, audio, and written component of that interview. And thanks again to Andrea for all that you're doing to increase access to harm reduction supplies and lead that prevention work locally. We hosted the last in a series of community forums related to our Age-Friendly Communities initiative at the YMCA last week. Recently, we were awarded a grant extension and additional funds to continue that work in partnership with Care Partners of Cook County, and anticipate presenting findings at a future Public Health and Human Services Board meeting on what we learned throughout those engagement sessions throughout the county late last year and early this year. Lastly, I have 2 more things. We also received a grant to continue our healthy housing work. So that will be the 2023 through 2026 budget years, and will allow us to continue to provide those home-based health assessments and connect residents with resources to mitigate some of the health concerns in their homes through the next couple years. So really excited about that as well. And lastly, as you all know, likely the 2024 legislative session kicked off last week. Lots of priorities in the Health and Human Services area. So going forward, I'll start including some updates in my monthly reports just to connect you all with more of a local context of what's happening within some of those priority areas as defined by our professional associations, those being the Local Public Health Association, LPHA, MACSA, which is the Minnesota Association of County Social Services Administrators, and then AMC, of course, the Association of Minnesota Counties.
Thank you.
Thank you.
Questions for Allison?
Praise for all your work. It's just amazing all that you do.
Serena?
Yeah.
Thank you. That moves us down to our items for board action, which is blank today. And then down to our committee reports. So pretty brief meeting here. First one is the Active Living Steering Committee. Commissioner White.
I unfortunately missed that one.
Okay. And then AUA. Have they met, or have you been able to?
They haven't met.
Okay.
They changed it.
And then we have the annual report included, and I don't know, did I ever get that to you, or did you find it? Is that
You got it to me.
okay? Goodness,
I remembered to include it.
that was quite a challenge. I went as I was reviewing the agenda. I clicked on that link, and it said, "Do you want to download it again?" And I said no, and clicked on the original one, and it wouldn't open again, which was the case with the original rigmarole. So then, once I did download it again, this time it worked. So that's.
It's a very nice report, and
Yeah.
it's giving me some ideas for putting together our year-end reports for the advisory councils that we work with. So thank you for sharing that.
I'm sorry?
Thank you for sharing that.
Oh, yeah. Oh, sorry, it took so long. AHA, and I sat in for Commissioner White and gave an update at our meeting on last Tuesday. And I haven't heard peep since then, and hopefully Commissioner White will be able to tie in with Rick at some point here. I don't know when that'll happen, but and then ARC Commissioner Hawkins is not here today. I don't know. You probably didn't hear anything, Commissioner White. And,
Nothing.
Yeah, and Commissioner Hawkins gave an update this last Tuesday too. So, Child Care Solutions Subcommittee, Commissioner Storley.
Okay, thank you. Yes, we did meet, actually on Valentine's Day.
Yes.
Right. Yes, some highlights, okay. We had some great handouts that we could print off later, which is always good to review. And just, we went over some of the ways that we're growing in the county, and that was through December, and that's all good, Nancy said. And sometimes it's good to kind of pause and see where we are with that. We do, by the year's end, we do have 11 providers, and we do have childcare slots available right now at 69, and children being served, about 91, and a little bit of budget money on that, which is always needed. And one of the things that we talked about was our outreach. How do we get word out to people? So they have used social media on Facebook and Instagram, print and media outreach, Boreal, WTIP, and then on NPR, geo-targeted. So that's a new term for me. I wasn't sure how we're targeting stuff with the geo.
Yeah.
That's they're trying that too. Yeah. And all around the county, Northwood's Child Care opened in January. Birch Grove, we're working on, a room to have for babies up to 3. And we have a few glitches, but hopefully maybe in March. And then there's going to be a new program in Lutzen, Rose Nest Nature Play School. And I don't have all the details on that, but I think that sounds kind of fun. It's an outdoor event type thing, so, we'll see how all that gets put together.
Awesome.
And where all that goes and when. And then she also sent us the Northeast Child Care Needs Summary, and so that was good to always have your name out there for financing. And she's working on a new deed grant application to attract new Cook County providers. So it's always a little fine print that says this is the way you have to look at it, and not old stuff, but new stuff, which is always good. And our next meeting is April 10th, so we're meeting every other month. Yeah.
Holy
so
smokes, that's a lot. Thank you for
lots of good stuff.
the update. And
Yeah.
I'm confused, are there, you said, were there openings? There's like 60-some openings? Is that?
69 available, there's 91 being served, and an additional 69 slots available?
Wow.
Are
So-
there age restrictions on those? What?
No, I don't think so. Did she say that, Grace?
I'll have to confirm with Nancy. I wasn't sure if she said that was the number of additional slots needed or if those were vacant.
Yeah.
I thought needed.
It's
Yeah.
needed.
I thought they were needed, but I'm,
Okay,
Needed.
thank you.
Needed.
I was confused,
Yeah.
thank you.
Yeah.
Okay.
Okay,
Yeah.
so that's what's needed.
Needed, yeah.
That's,
think
thank
there
you
was
for clarifying, because I was
the-
confused, like, wait, what? I thought,
Yeah.
okay.
That we already
Yeah, we know.
Thank you, okay, great.
accomplished quite a bit, yeah.
I mean, not great, but
Yeah.
we got it, we target.
I know
Please,
the
Brandon.
Congregational Church building has a daycare. That started in January, so I don't know if it was in your report, but that's not, I think they have openings, I think.
Oh.
I think there are three 3-year-olds during the day, and for some reason, maybe they can't take certain ages, but I don't know. And then after school, I think more,
Yeah,
possibly, so.
That makes
I don't
sense.
really know, but it is running, so it's good.
yeah. It's wonderful, and it's wonderful just to hear about all the initiatives and angles, strategies that Nancy's able to pursue for our community. Thank you. I'll move on to the CHB, which I gave a little report this last Tuesday. I did find the annual report that Susan gave us, so I can pass that on to Allison, and she can distribute that to everybody. Moving on to the local mental health advisory council. Rana.
Yep, we met, and we had some people who were at another meeting, so we didn't have quite as big a group as sometimes, but, so it went faster, I guess. We did talk a lot about recruiting for new positions, and also crisis stabilization and the rural communities opioid response and restorative justice, a lot of the programs that Inger's working on or Andrea Orst, and really, just really impressive, all the different things that are going on, and some, we haven't had anybody, I don't think from the school come and talk, but I think there are things going on there that are good. A lot of programs started up and that I've heard about. So is there anything else that?
I would just add to the update on crisis stabilization that Human Development Center, HDC, recently took over operations of the Regional Crisis Stabilization Center and is now operating under the name Yellow Leaf Stabilization Center. Just got information late last week on their referral processes and packets, so I've been working to get that out within our team and with local partners. So excited to have additional capacity within the region for regional mental health crisis stabilization.
And that's in Duluth.
That's in Duluth,
Yeah.
yes.
It's kind of replacing Birch Tree, but still, they still have the transportation issues and all of those things, but it's good that it got going again.
Yeah.
So,
It's huge. And a bit of a hiccup there, so I'm glad we're making progress. Council on Aging, Commissioner White. Oh, I'm sorry, Restorative Justice, we skipped, but Commissioner Hawkins is not here. I did not have any info except for there's a report in our packet, so I'll move on, sorry.
The speaker of the day. Council on Aging, that group continues to be energized by their commitment to providing better services, being there for people to provide services to a wider range of ages of community members. They are seeking new members, a couple of board members. They've gotten all of their ducks in a row as far as finances and directions that they're going, and it's the time of year now that it's grant writing, pursuing funding to help them go. They again want to let people know that if you need good food at an affordable price, they are the place, the hub is the place to go. There's also carry out if that's needed. If you have a neighbor or even yourself, they do freeze meals, and you can pick them up and take them home. I know somebody who lives far from town, does not get here often, but has a need for help with his household, with his helping with his wife. The one thing about getting food from the hub is they'd like you to call and say you're coming, and that's it. But it's a very good program for, food's pretty darn good. Most days, except when they have tuna fish. That's an editorial comment. It's probably fine tuna, but I don't know. Won't eat it. That's it. They're doing well, and there's more. There are now 2 bone builder times in the week for community people to come in and work on building the strength in their bones.
Frank?
Question for you. I know the hub does meals there. And they also furnish the Meals on Wheels program for the city.
Yes,
Correct?
they deliver with,
5 miles with that.
5 miles,
Yes.
okay, 5 miles. Now, what you're talking about, as far as pickup,
yes, yeah.
that is that's an additional service.
That is something that they have been doing. How long they've been doing that, I don't know, but I would imagine you would need to also let them know that that
Sure.
would be what you needed, so they have the extra meals.
And would that be like a one meal pickup or pickup for the week, or do you
Oh,
have any details about
the
that?
person I am aware of picks up for a week at a time, for the wife and the husband, for both of them.
That's extremely important to know, especially for the people outside the delivery area. This is the first I've heard of it. So
Oh.
I can only know what I know. If I haven't heard about it, then I have to suspect a lot of people haven't heard about it. So maybe this is something that can be publicized somehow.
Okay. And I do know
To people who
that,
don't come into the hub regularly.
right, right. And I do know, because the person, it's really necessary, because on top of the caregiving and working out of the house for income, somebody's got to cook, and it's got to be this same person, so this really helps a lot.
Yeah, yeah. And is this income-based or free or so much per meal or, you know?
Like $4 and
It's $4 something, no one checks what your income is. Can-
So it's just $4 per meal?
But it might, that price might have changed some, but it's really affordable.
Yeah, that's what I thought it was.
Thank you.
too. I think it's just worth noting the flexibility that they're willing to provide for people's needs that are, like you said, outside of the Meals on Wheels area. That's really fantastic, and yeah, kudos to the hub for working with people like that. I think it'd be so helpful. I mean, once they are comfortable enough or have their path set, it'd be really great to have a mini presentation or just check in with this group too, just to hear more about it, because
And-
there's so much going on.
Right,
down
and
there.
AEOA, they support the food program is a huge, so that's why the cost for people to get a meal is so affordable.
Yeah, and in the spirit of yes and, tying in with the transportation thing, I'm sure it could be organized to get people who don't have to drive in 50 miles from up Gunflint Trail or down in Tofty or whatever it might be, to arrange some kind of a delivery system. You know, I would be happy to.
Or a satellite-
I'm in town
satellite
next
link.
week, so I can
Yeah.
certainly pick up meals and drop them off for somebody. And I'm sure there's a lot of that available if people knew that there was a need.
That's a good
I
idea.
knew that it was an option,
Yeah,
that it's a
right.
possibility for,
Yeah, yeah.
I know they've had it describe the program in their newsletter, but I'm not sure how widely distributed the newsletter gets.
yes, they're working on all sorts of,
We
have you
can-
seen the news?
Oh, Jana, please, yeah.
If you just Google the Hub Grand Marais, you can find their website and you can click on meals, and there's some basic information about cost and how to either call for pickup or something like that. So that's a quick and easy way if you've got internet access to get some information about the lunches.
Thank you. Easy peasy, eh? Somewhat.
But
I
that's
think
only if you
updates-
know, that's only if you know about it.
Well, it's, yeah.
It's the push to let people know that this is available. Go to the hub and,
Yeah, and we can all do our part there, and then I think, there's been some updates on the radio, but it's never enough sharing of information. Did you have your hand, Mr. Yorkie?
Yes, thank you, Mr. Chair. I was just going to ask, are there any concerns about capacity? And like, if they had a bunch of new people sign up, would that pose a problem? Because
Right.
I don't know what their setup is.
Right,
I don't need, they do have a cook, I mean,
Yeah.
they've
But
just,
they have two staff,
cooks.
so.
but they do have 2 backup cooks besides the cook, so the food will keep coming. But yes, they don't have much for staff at this moment in time.
Might be good to bring up at your monthly meeting when you attend, and if there is capacity to add additional services regarding those meal pickups, then maybe Larry Dean
Yeah.
usually does those WTIP interviews, could then bring that up.
Rana, did I see your
I
hand?
was just going to say they'd probably need like at least a week to pre-order the food if they're
Sure.
going to have, you know, if
A
you
big
especially if you're
influx.
getting a week worth of food and they're going to freeze it, you're going to have 2 weeks' notice to order that so that they can get it and then freeze it and then you can pick it up, so.
Yeah, and it's the same food that they serve every day.
Right.
So they just make
Just the-
extra.
The quantity, yeah.
Yeah.
They'd need
But
to
if
know ahead of
suddenly
time.
12 people say, oh, I need them, and
It's
we'll
a-
be in to pick it up
We have to
Exactly.
think about staff and then
Right.
For a
also
week.
freezer space.
for a week.
Right, right.
Yeah.
No, that's
true.
next level
Yeah,
for
that's
sure.
great, yeah.
A lot of ins, a lot of outs, a lot of what have yous. But that's awesome. Thank you for that update there. Very, very exciting stuff happening down there, and would love a little mini presentation or just connect for us to all be able to spread that information more and better support our community. Emergency Preparedness Committee, Commissioner Sullivan.
All right, well, I missed part of the meeting due to that long meeting that we had last Tuesday. But one of the things we're working on, and particularly Mike Keyport, is he's coordinating and planning for our Emergency Preparedness Conference, and that will be in April, Saturday, April 20th, Earth Day, so there's a little conflict with Earth Day activities at ISD 166, and then the Emergency Conference, and people wanting to be in both places, but we'll get that all sorted out. But if you want to get that date on your calendar, Saturday, April 20th.
Thank you. Healthcare Planning Committee, Commissioner Storley.
Thank you. We did meet, and just a few highlights. We did get a report from Lindsay, a good report that she's had somebody new start in the office, Destiny Weinert, and she's starting there as a development coordinator, so that's good.
Yeah.
However, there's always some challenging news, and that is that there's a $700 million cut from the Senate, the House, and the President's '24 budget. And so this is 37% less than the fiscal year of '23. And so this is really a devastating cut for thousands of people who work with violence prevention. And so that's a concern that we need to maybe take further when we go to our legislative sessions later today. Let's see, Grace was there. Care Partners, Julie Wilson reported that she's now reviving a advanced care planning process, and that's going to start actually next week. So that's in care planning, advanced care planning. And the Lunch and Learns continue, and next week on the 28th, she will have Jason Hale come to be a presenter, and I believe that's at the Hub on the 28th. So he'll come there and talk about housing. Kate Serba from the clinic reports that they're doing more outreach regarding the sliding fee scheduling program, and we're trying to spread the word on that, that's available, and to just come and talk about it. And Kimber reported at that time that there was a number of COVID cases, but hopefully by now that's simmered down and nothing new on there. So that's the health report from that.
Thank you, Commissioner Storley. NACO.
Nico,
Yeah,
okay.
everything.
Well, I'm waiting for the public health and resource report from NACO. They just finished last week out in Washington DC, and so I'm waiting for our meeting, which we'll be Zooming either next week or the first week of March, and getting highlights on that and seeing my input when I send in my votes for what I thought was important for them to talk about. So that'll be for March.
All right, thank you. Northeast Minnesota Office of Job Training, and Commissioner Hawkins is not here today. Probably not a whole lot to report. Commissioner Starley, did you hear anything about that? Probably not. Okay. And North Shore Collaborative, we gave a little update at our last meeting Tuesday, so nothing to report there, except for we now have our preparatory strategic planning materials from Barb Caskey, so it'll be fun to dive into that. And then Public Health Advisory Council, Frank.
Just a couple little things. We're hearing from a couple other of the councils and committees. Emphasis always on recruiting. And Allison did a great job on reviewing our bylaws. And I think we're allowed to have up to like 35 members. So we have started a recruiting program. Allison, I'm sure that'll be an item later on the agenda. You already got your first application.
Yes, that was approved on the consent agenda, so very glad
Okay,
to be welcoming
great.
a new member.
Great. But one of the asks that I did at the last meeting was I asked each member to one-on-one ask 3 other people who they thought might be interested so we at our next meeting we will see what results that brings. I know that Allison's also, there's been press releases, and a couple of weeks before our next meeting, which is starting to come up now, we're going to have PSAs and other releases to other media, inviting people, A, to apply, or B, to attend the next meeting, because they're open meeting. Come and see if you'd like to join us. This is what we do. So this is what we're focusing on now, is building our capacity. And the other thing I would like to mention is that previously we'd spoken about CDC's new Office of Rural Health. Overlapping with this meeting, which I'll be moving into directly after this, is our seminar on eliminating geographic inequities. So if something valuable comes out of that's directly applicable, I'll report on that next time.
Excellent, thank you.
Just a comment to add quickly that the 2-pager that Grace was referencing in her report on the health assessment and health improvement plan, I think could be a really effective recruitment tool for advisory councils in terms of one of the larger stakeholder groups engaged in that work.
Yeah, make some tangible targets or just
Excellent.
intentions, yeah.
Excellent, and even the participants, and that's something else.
Yeah.
The participants in that community health assessment probably should all get an email. Okay, you came up with a plan, now let's move ahead to implementing it. Thank you.
All right. Anything for the good of the order here? Commissioner Starley, please.
Thank you. Well, I'm hearing, and I'm part of recruiting too, and how do we get people to know what's going on? They all have busy lives, and I'm lucky that in the West End, I have 3 townships, a school, a grocery store, and I put a lot of flyers out. And for instance, the one that's coming up about recycling and composting, so we were sent the flyer, okay? So I'm taking that flyer and I'm going to put it at the post offices where people go. If you get your mail delivered, then you'll have to read it on a bulletin board somewhere else. And I'm going to attach like junk, like a piece of foam, like whatever, to get their attention. Because we get so busy, and next Wednesday will come and go, and it's like, well, if they don't have a reason to look at a bulletin board, this might catch their eye. And I don't know what else, you have
Dirty
post
sock.
office here, and you have grocery stores, and for our garden club, for our flower show, we hang like 30 different things around to remind people right before, because, oh yeah, I'll remember that. Then they don't, And this particular one is really important for our county and what we need to discuss about our waste program. So anyway, you know, whatever else kind of works to jog people's memory, emails, like you say, once you're on a committee, and ask 3 more people, you know, the paper to some degree. So we use all our resources and then some.
Right,
Yeah.
yeah. Well, thank
Question,
you.
Commissioner?
Mhm.
People have a lot of time in waiting rooms. Is it against the clinic policy or the dentist's office, or I don't know, just to have, I'm just throwing it out there. I have no idea if I'd look at something if I were, but to have, people look at bulletin boards when they have, I got 5 minutes, let's look at something. So I think that's a great idea, what you're doing, but
Yeah, and getting those targets, that's a good idea too. Captured audience, so to speak.
yeah, bored.
Yeah, yeah. And just to clarify a little bit, there was some confusion. That conversation is not a county-led conversation.
No.
Yeah, Cook County was, it was on our website, and it was, there just been some confusion, so I think it's like you said, an extremely important issue for our community, but that's going to be led from an outside organization, and of course, with our partnership intentions with North Shore Waste and just our community needs, I think it's really important. It's just also just not our purview at the moment, but it's certainly
That doesn't say that.
Right. Yeah,
Right,
no,
right.
certainly relevant there too, and I'm excited to hear more about what comes from that and just the engagement. They did an excellent job of getting that blast out, so thank you for sharing that too. Okay, anything else for the good of the order? All right, we are adjourned.